Welcome, everyone, on this brisk, cold evening, January 14th. And we're very, very excited to have you all with us. Pain is a pathway, discussion on chronic pain. And we're very, very blessed to have someone not only knowledgeable, but that has experienced it. And that really solidifies the presentation even more. Through tomorrow at midnight, the 200 PV order then will go away. And I would highly recommend, if you've already placed your January order, to call doTERRA, and Kayla will put it in the chat what the number is. And just, you could make up the difference in your second order, but it has to be done by tomorrow. So if you've placed even $100 order, you're going to get this for free. If you place another 100, what a good deal. And then also through midnight tomorrow is the Digest Zen. And I am really, really excited about the Healthy 100 promotion. So if you're new to doTERRA this month, or you haven't been a customer for a year, we welcome you back. If you place a 100 PV order this month in January, the same people place 100 next month, you're going to receive 100 free product points. That is so generous of doTERRA. I'm going to just do a sneak peek for the next several weeks of what's coming up. Understanding EMFs. Guys, it's going to make you shiver when you really find out what's going on in our home with all these EMFs. And then the 28th is Dr. Lori Langfit. We all know she's an expert in so many things, but she was primarily going to be talking about doTERRA's castor oil. And then if you're within maybe even a couple hours, please join us next Thursday, the 22nd, here in Eau Claire. I am just thrilled that I'm able to introduce Betty Torres that evening, presidential out of San Antonio, Texas. So please come. Great experience as well. And then February, understanding and supporting your immune system. We need this like right now with Dr. Caitlin. And Marie, Valentine's Day with doTERRA. And I think you've been on some of hers. She's just outstanding. Okay, with Discovery Essentials, they decided this year to partner with PJ Hanks. And I think probably everyone that's on the call knows who PJ Hanks is. If you don't, at the end, my contact information is out there. Please reach out. PJ is doing really a 4 phases throughout. And so it is even because some people aren't ready to even start the 90-day reset. And so there is a cost, and anybody on the call here tonight as part of the Discovery Essential community, there is a code. So Kayla will put in the chat later on, because we don't want it out there anywhere. You can text me and I will tell you what it is after class or even before. And to register for it, it's pjhanks.com/reset. You're going to be receiving daily text and daily emails. So you're going to be on this amazing journey with this community. Feel free to take pictures. You can text me for the 50% off discount code when you register, but please don't share. When you get it from me, please don't share it with anybody via social media. You can give a friend a call and share it like that, but we don't want this posted really anywhere. Without further ado, Dr. Laura is a doctor of physical therapy. She is a very proud and new diamond with doTERRA. And what that means is she's taught many, many, many classes, and you'll find her all over on social media. A national board certified health and wellness coach, certified women's health and functional nutrition coach, and insulin resistance coach. We're in awesome hands with a lot of knowledge. And I'm going to stop sharing and turn this over to this fine, beautiful lady.
Oh my goodness. What an introduction. Thank you so much, Sandy. It is an honor to be here. And I like to tell people, I kind of think I'm where sassy meets science. I love to have fun, but I also love the science piece of all of this. And this is one of the topics that I'm really passionate about. because I'm a wounded healer, as a lot of you know and have had your own experiences, which probably brought you into doTERRA. So I have overcome cancer. I've had 18 surgeries, including major orthopedic surgery, was diagnosed with chronic Lyme and pelvic pain and autoimmune issues. And I'm really here to empower you and show you how to reclaim your health. And I share that because it's one thing to be a practitioner or clinician, it's another thing to go through your own journey with this. And so this CT scan shows the sarcoma that I had in my abdomen. It was the size of a softball. It was removed. They put synthetic mesh in, the mesh herniated. So I actually had a really major surgery where they removed all the synthetic mesh, moved my abdominal muscle around to close this big 12 centimeter ventral hernia. And I had drains coming out of me, was in the hospital for 5 days. It was quite a journey. And I've also been through some major, major hip surgeries for adult hip dysplasia, where they broke my hip in multiple places to build me a new hip joint. I was too young for a hip replacement. This is major orthopedic surgery, much larger than, say, a total hip replacement. And I've had 8 hip surgeries, 4 on each hip for this journey. You can see these rashes here. The one on my back, that's Bartonella. It's a co-infection of Lyme. And I've done so many things. So this picture up here on the top right, this was rashes with Lyme infection, and just changing my diet and lifestyle reduced it quite a bit. But one of the things that I was struggling with still was chronic pain. And I had years of migraines, pelvic pain, daily headaches, lots of things. And I just share that because I know how you feel. I see you. So if you've had autoimmune issues, cancer, lots of surgeries, I was told I had chronic fatigue and fibromyalgia and all of these things. I have that experience here. And the information that I'm going to share with you tonight has really transformed my life. But before we get into a discussion on pain, we have to know what it is. And it's a signal from the brain, not just the body. And it alerts us to any perceived threat or injury. And this word is really important, perceived, because the brain is going to decide how it's going to interact with this signal and if it's a threat. There's different types of pain. We have acute pain, which is something that comes on very quickly. You stub your toe, you sprain your ankle, you're going to feel that right away, versus chronic. And in the medical community, we kind of consider something chronic that's been going on for 3 to 6 months and hasn't resolved. So it's going to be pain that continues even after that tissue healing has happened. Pain is protective. It's not punishing. And I think it's really important. If we didn't have pain, we would die. So it is really important that we have pain. Pain can often get villainized, and we'll talk about that. But it can also be emotional or physical or both. And what's really fascinating is emotional pain can light up the centers of the brain, very similar to physical pain. And chronic pain may be signaled, it could be trauma, it could be stress, it could be emotional overload. And the nervous system can get stuck in a protection mode. And we'll talk about that as well. So, we're going to start with foundational wellness and tools for pain. And then we're going to dive into nervous system retraining. And hopefully, you know about our VMG Plus. I love it. I hope you love it. But this is pretty incredible that after taking it for 6 weeks, they saw a 43% reduction in C-reactive protein levels. And that's a systemic marker for inflammation in the body. It can reduce oxidative stress by 150%. Oxidative stress, I kind of think of it like rust that can show up over time. Just us showing up and being a human and breathing and eating is going to create a level of oxidative stress. And it kind of depends on, is your body able to clear that? So this is huge. It's liposomal. It allows for really great absorption, and it has a retention rate of 8 hours. So it's going to stay in your bloodstream for 8 hours, so those cells to go and grab it and utilize it. And some of you may know my dear friend, Linda. She's on Instagram. She is such a joy. And she just thought that a lot of the aches and pains that she was having were normal and age related. Linda's 78 years young. I think she's going to be 79 years young in May. And when she started taking our foundational wellness supplements, noticed that she could get out of the bed without a cane. She could start to move around. And if you follow her on Instagram, she's dancing and she's drinking her VMG Plus every morning. So this can be a really powerful tool. Our E Omega Plus, also fish oil, is really, really important. And getting those omega-3 fatty acids can help reduce inflammation, can help with joint pain, muscle pain, period cramps, with exercise recovery, and also has a lot of cardioprotective benefits like decreasing your resting heart rate, decreasing diastolic blood pressure. And that is huge because it's taking off the load where your heart doesn't have to work as hard. I love this specifically for people with brain fog. And we need our omega fatty acids. They're essential. And this is, again, one that can actually be absorbed. A lot of the supplements that you find at the health food store or the grocery store, they, especially fish oils, can be oxidized, they can be rancid, they can actually cause more inflammation. But I think, oh, it's so, so important that we're taking a high quality vitamin and mineral like our BMG plus and a fish oil like our E omega plus, especially if we're dealing with pain. And then our PB Restore. I call this, it's a probiotic with backup dancers because it's got your prebiotics, probiotics, postbiotics, and bacterial phages. And we know that our gut is our second brain. It is so, so important for serotonin and dopamine and our immune system and even our thyroid hormone, because a lot of the inflammation in the body is controlled by the gut. But what you may not know is that we need healthy bacteria in the gut because it creates a positive feedback loop through the vagus nerve and it helps to increase its tone. And the vagus nerve is one of the really powerful indicators of how well our nervous system is working. So this is a key player, not only for immune support, but also with regulating nervous system, which is going to help with pain. So those are kind of the big guns, our three big guns, but then we have other products that can help like Terrazyme. I love this product so much. We often think of taking it for like gas or if we're backed up or if we just need a little bit of help breaking down and really absorbing our food. But if you take Terrazyme on an empty stomach, it can help with pain. It can help with breaking down these inflammatory proteins in the bloodstream. So it's another way that you could kind of play with this supplement that we love so much. Enzymes are really powerful and a great tool. Another one is our turmeric dual chamber capsules. So these are a powerhouse because it's got the turmerones from the essential oil with the curcuminoids. So it's the whole plant together, which allows for an 11 times absorption. It's amazing. There's no other turmeric supplement on the market that does what ours does. And people ask me all the time, well, why doesn't ours have black pepper? Because it has those turmerones. So you're going to get a maximum absorption, absorbs even better than a traditional turmeric supplement that we're told that we need black pepper and a healthy fat. So this is a powerhouse, and this is going to be one that you would go to for persistent pain that you have. So I really recommend taking the turmeric internally and then using our turmeric essential oil with a carrier oil topically so that you're getting systemic support as well as localized support with things. Copaiba is amazing, and it's a really good one for immediate pain. So this works on our CB2 receptors. It helps support your nervous system, cardiovascular system, immune system, and it really also helps with emotional support. And we saw at convention that it helps people move better, better mobility, better range of motion, improves their gut health, and helps to manage their body's response to everyday inflammation. So this is a power hitter that you can add in to support you, as well as our frankincense boswellic acid complex. So you can take 1 to 2 capsules twice a day as needed. This is going to be another powerhouse for persistent pain. So think deep long-term inflammation in joints or tissues or maybe old injuries. This one works on the 5-LOX inflammatory pathway, which is often responsible for things like stiffness and swelling and chronic discomfort. So I kind of think of this one as calming inflammation at the root. It's not going to be one for instant relief, but this is one that you're going to see support with taking it consistently over time. And then our deep blue polyphenol complex. This is so great for achy muscles, for occasional discomforts. You could take one in the morning with breakfast, one in the evening with dinner. But I think about this as your joint health, mobility, and pain one. And I think of it more as fast acting support. So maybe I kind of like it as like your non-tox Tylenol, if you will. Like if you need to kind of take something and feel better quickly, this is a nice one to add in for support here. And then our deep blue rubber stick. Oh my gosh, we're huge fans of our deep blue. My mom calls it her magic sauce. I love this text that I got from an oil client of mine that says, it works so good. It's like a miracle in a tube. It really is. So this is going to help to soothe your muscles and joints. I like putting the stick in my gym bag because I do a lot of weightlifting and I don't want my hands to get greasy. So I apply it over my muscles before and after my lifts. And then the Deep Blue Rub lives in my bathroom. And it's that deeper penetrating for maybe in the evening or the next day when I get those sore muscles. So we have lots of incredible tools from doTERRA that we could use in many different ways. This is one of my favorite for internal support, where you can grab a veggie capsule and do 2 drops each of frankincense, marjoram, copaiba, and lemongrass, and take that with food. I kind of treat it like I would a pain pill every 4 to 6 hours as needed. My aunt was recovering from surgery, carpal tunnel surgery, and she said, Laura, this worked better than anything else that she tried or was offered. So a really, really great powerhouse combo there to try. And then you can also make a roller. So adding 8 to 10 drops of your Aroma Touch, Copaiba, Deep Blue, and turmeric essential oil, top with your favorite carrier oil of choice. Mine is fractionated coconut oil. Roll it over the area of concern, and you can do that every hour or as often as needed. Can be really powerful. Diffuse your oils for pain. This may be one that you don't think about very often. We think about diffusing for respiratory support, emotional support, cleansing and purifying the air. But there's some fascinating research about how just diffusing lavender oil can help reduce pain in postoperative patients. We see this very often with wild orange oil as well, helping to reduce anxious feelings in patients. So use your tools in all the ways, aromatically, topically, and internally, to help to bring more calm to the nervous system. And you'll see what I mean by that. We'll go deeper into that. So we just hit lots of doTERRA tools that can help you with things. And are you still in pain? So you've tried these things, maybe you're still struggling. This is where we're going to get into a deeper conversation on the nervous system. And this is where I'm going to ask you to take a deep breath. I'm going to hold you by the hand. As I learned this, even as a doctor of physical therapy, they say the truth will set you free, but first it will tick you off. And it did. This is like it turned my whole world upside down. So I really want to encourage you, take what resonates, disregard the rest, but be open. Come to this with an open mind. And we're going to kind of go on this adventure together here. But there is a book. So in April of 2024, I found this book called The Way Out by Alan Gordon, and it talks about neuroplastic pain. And this is when your brain misfires pain signals, even when there's no structural cause for pain. Or it just continues to keep firing. Maybe that structural injury is already healed. There's many, many different names for this. So one is tension myositis syndrome, or TMS. Some people call it neuroplastic pain. Some people call it mind-body syndrome. It's all talking about the same thing. But at least 90% of all chronic pain conditions are actually neuroplastic in nature. And you can retrain the brain with nervous system regulation. So we can actually do pain reprocessing therapy to help with this. That book is fantastic. The doctor, the physician that actually came up with this term, TMS, tension myositis syndrome, is Dr. John Sarno. And he was a kind of pioneer in this field. As you can imagine, he was praised by some and then kind of called a quack by others. But he really had this theory that pain is caused by repressed emotions and brain-based patterns, and that the brain creates real physical pain to distract from emotional distress. And that emotions and stress activate the exact same parts of the brain as does a physical injury. And as I'm talking about this, as we're diving deeper into TMS, I want to be very, very clear that I'm not saying the pain is in your head, because I've been told that by many medical practitioners. Medical gaslighting is a real thing. That is not what I'm saying. I'm saying your pain is 100% real. And if we were to do a functional MRI of your brain with somebody with chronic pain, it would light up like a Christmas tree. And the brain is neuroplastic, and we can start to work with the brain and the nervous system to help to reduce the pain. Because if you're like me, you've probably been working on the physical body for a really, really long time, going to chiropractors, physical therapists, acupuncturists, massage therapists, all the things. You've been to all the doctors, you've tried all the treatments, you've done all the things. These are the people that I'm talking to here. And so we've been addressing things with the physical body for such a long time that it's now time to start working with our brain and our nervous system. But these are kind of some of the signs that you might be dealing with TMS. You have pain with no clear physical cause or diagnosis. The symptoms could move around or move to new locations. Maybe the pain gets worse with stress or emotional triggers. You've tried everything physical with little relief or temporary relief. You resonate with high stress, people pleasing, or repressed emotions with this. There are clues in yourself that this could be you. Chronic pain has a personality type. We tend to be perfectionists and hold ourselves to impossibly high standards. We tend to be people pleasers and prioritize others' needs over our own. There's a goodism there, like we want to be the good one, we want to be the helper. Maybe we have high anxiety, or we're hypervigilant, or we're a high achiever, we're really driven, we're responsible, we're strong, we get stuff done, highly intelligent or analytical. We could be emotionally repressed. We say yes to everything and maybe overextending ourselves to meet the needs and expectations of others. We can tend to be really hard on ourselves and struggle with self-criticism or this constant need to do more. Anybody deal with that? Just me? Are you feeling seen? Maybe just a little bit. Maybe you have a few of those. Maybe you have a lot of those like me. It's okay. I see you. It's going to be okay. There can be clues in your habits. So maybe you talk really fast, or you're rushing through tasks all the time, or you breathe really shallow. Like you never stop and take a deep breath, or you're holding your breath constantly, or you're constantly multitasking. Maybe you're on this call, but you're also checking your email and you're also checking your social media and you're trying to do a bunch of things all at once, or you're just always on your phone, or you feel like you have to get back to messages immediately, or maybe you leave drawers or kitchen cabinets open because it's like you're just on to the next thing and it feels like we don't have time. Or my husband laughs at me for this. I'll make a cup of coffee, but I forget to drink it. Like it's still on the kitchen on the kitchen countertop. Maybe you have one of these. These are all clues of how our nervous system is doing. These are clues for the body. Maybe you have an increased heart rate, shallow breathing, or higher muscle tension. Maybe you just have a difficult time relaxing or staying still, or you feel like you're always having to brace, or you're on edge, or you're a little bit hypervigilant, or irritable, or anxious, or maybe you just constantly feel overwhelmed and it doesn't feel safe for your body to rest. You could have internal pressures, putting a lot of pressure on yourself, being really critical, blaming yourself. You feel more obligations to do things because you have this really strong sense of duty and you worry excessively and you feel guilty for resting or setting boundaries or saying no. I'm 41 years old and I just started learning how to say no and set boundaries in my life. Or maybe you're just overly conscientious and you really care about others to the exclusion of doing things for you. These are all the personality traits, if you will, of chronic pain. Now, there is an amazing doctor, Dr. Howard Schubiner, and he specializes in mind body and being able to diagnose and kind of decode if something is a structural issue or if it is a mind body issue. And he did a really amazing lecture, kind of helping with differential diagnosis with these things. And he was talking about how chronic Lyme, EBV, mast cell activation syndrome, EDS, POTS, SIBO, long COVID, that these are neuroplastic in nature. And I was diagnosed with almost every single thing on here. And since working with brain retraining, have seen such a difference in my life. Dizziness, vertigo, a lot of these things are also classic neuroplastic in nature. This is the proportion of chronic conditions that are brain induced. So 98% of headaches. I had daily headaches for 20 years and very frequent migraines. I was told I had fibromyalgia. I was told I had IBS. and anxiety and depression. Chronic pelvic pain was another thing that I struggled with, chronic neck or back pain. And what's really interesting is in this space, a lot of us are struggling with pelvic pain or chronic pain. It's not just one thing. It may be a series of things. Like we may have back pain, but we may also struggle with headaches or IBS or these other things. So it's all related and goes back to the nervous system. And Dr. Schubiner was talking about research on 40% of 30-year-olds have degenerative disc disease. So if you take 30-year-olds off the street and we do an MRI scan on them, 40% of them have degenerative disc disease and 30% have bulging discs and they have zero pain, and that these are normal findings. For 50-year-olds that they take and they scan that have no pain, 80% of 50-year-olds have degenerative disc disease with no pain. 60% have bulging discs with no pain, and 30% have herniated discs with no pain. So Dr. Schubiner, he was saying that we look at these things and they sound really scary, right? Like degenerative disc disease or bulging discs or all these things. But how can it be that we can have a very high percentage of people who have these but don't have pain? So he was talking about looking at them as if they're a gray hair or a wrinkle. Like we wouldn't say that somebody's headaches are caused because they have wrinkles on their face or gray hairs as they get older. And this graphic is really interesting because, again, it talks about a lot of these when we're looking at the research and reviewing the percentage of people that have these things like meniscal tears or labral tears or osteoarthritis or different things, and how people can have these on scans and be asymptomatic, have no pain. How can that be? Because pain comes from the brain. We often think that pain is coming from an injury or the tissue or there was a physical abnormality, but that's not true. So pain is not the problem. It can actually be the solution. When we're having chronic pain, that's usually kind of a check engine light. Like the body is trying to get our attention. And so a lot of this is kind of learning to speak the language of the body when we're talking about TMS. It's really important to know that, again, the pain is real and it's generated from the brain. So we can start to work with journaling, with calming the nervous system daily, with education on how pain works and learning about the pain science. There are some people that just reading the book The Way Out or just reading a book by Dr. John Sarno, he has a book called Heal Your Back Pain. People will read these books and then just 2 weeks later be cured. Like their chronic pain that they've had forever is gone because they now understand how the pain science works with that. It's really wild. And we need to start moving again. Often we're afraid to move because we're like, oh, that hurts. That's causing pain. It's not safe. But it actually is. This is how we retrain, and we retrain the brain and those neural circuits that are firing that it is safe to do these things, that we can rewire fear-based patterns with more curiosity and self-compassion with this. So things like spending more time in nature, spending less time on screens and social media, taking a break throughout the day with this, checking in with your body to just see how your nervous system is feeling. Are you feeling calm? Are you feeling frazzled? Like approaching pain with curiosity instead of fear, and reminding your body that you're safe. So embracing it with compassion instead of running from it. And we start to kind of look into the somatic experience. So I have some interesting stories for you here. One, Dr. Schubiner shared of how a patient was at a construction site and had a nail gun, and the nail gun went through his hand. And he had zero pain and was able to drive himself to the hospital and get it looked at. And we may think, oh my gosh, how is that possible that he could have zero pain with this? Because the brain decides what we need to do. And versus panicking and having a whole lot of pain, he was by himself. The brain said, hey, no, we got to get to the hospital. So kind of like if you're out for a run and you twist your ankle and you have pain, you may be really struggling and not want to run anymore. But if there's a tiger chasing you, you're going to run even on that ankle that is now sprained. So the brain triages and goes, okay, what's safe? What do we need to do? Which is how the brain can kind of turn on and decipher whether or not we have pain. Another example was a man on a construction site had this nail go through his shoe and he screamed. He was in agonizing pain. They got him to the hospital. They put him on pain meds, IV pain meds right away. They were trying to control his pain. He was having horrible, horrible pain. They get the shoe off, and there was the nail went between the toes. Didn't actually pierce the skin at all, didn't actually go through the foot at all. But he had excruciating pain, even though it was totally fine because the brain saw that and went, oh, something really bad is happening. We need to get going. So it's really fascinating how the brain can interpret and triage things like that. I think people underestimate the power of the brain and our nervous system and how much it actually can control our experiences with a lot of things, which is really wild. So it's a powerful thing. And we want to look at these 5 F's. So pain and symptoms is about fear. So we learn to manage it. So when we feel the pain, when we feel those sensations, instead of going, oh my gosh, something's wrong, and like going into a panic, we can just be like, I'm safe. There's nothing physiologically wrong with me. We're okay. We can take a deep breath. I can feel these sensations. Like we start to stop freaking out about it with that. We move our focus away from the symptoms, not towards it. We kind of notice it. I think about it like a little 2-year-old. You know how they kind of come up to you and they're like, hey, hey, hey. And then once you like acknowledge and be like, hey, I see you. Okay. And then they're like, cool. And then they'll go do their thing. It's kind of like that with pain of just like noticing it. Hey, I see you. And we're doing this right now. We're safe. We're okay. You're not broken. You don't have to fix anything. And in fact, going into that fix it mentality can increase fear and make your symptoms worse with this. How many times have we done that? Gone on Google and started to research or get on ChatGPT and we're putting all our symptoms in and it's like, and now we're panicking. That's also going to send our nervous system into a little bit of spiral. Getting frustrated with it is going to make it worse. We kind of make it our friend where we can be kind. We can be patient. We can keep persevering here. We can hold space for it and starting to not fight with it and not fight with the symptoms. The more that we push, the harder that these symptoms are going to stick around because all of these fear, focusing on it, fixating on it, being really frustrated with it, trying to fight it are all signals that the brain's going to be like, oh, it's not safe. See, like, ooh, like we're researching this now. We're trying to figure out all of these things now. So starting to take a deep breath and remind your body that you're safe to allow these symptoms to show up. Easier said than done, takes some practice, but is really, really powerful. So things that you can start to say to yourself, these symptoms may feel dangerous, but they cannot harm me. My body is stronger than these symptoms may make me feel. This sensation will shift. What if the best case outcome happened? We're so often worried or fixating or focusing on worst case scenarios. What if the best one happened? Or I like this one. I have time to sort this out. I have time. I have space. I don't know how this will play out, but it's not my job to tell the future. Or just I'm safe, or I'm safe enough, or I'm good enough. One of my favorites is either way, it's going to be okay. Just reminding that. So think about pain as, let's say you had a small child who was afraid that there's a monster under their bed. We'd probably talk to it in a really soothing voice to that child and be like, hey, it's okay. I see you. Like, come here, I've got you. Like, very calm, very like, look, we can kind of peek under and look, there's nothing to be afraid of. Kind of staying with that child till they fall asleep. Or if you have a pet or an animal that you love, like maybe you're taking them to the vet and they're kind of freaking out. And like we can't really speak their language, but they understand our tone. So we speak to them in like a very soft, soothing tone. It's okay. I see you. I've got you. Like these are things that we start to do for ourselves with our brain, like adding these tools in. I know it sounds weird, but hey, you've tried a lot of other stuff that hasn't worked. So let's try talking and being kind to ourselves and working with our brain. One of the things that's really important to do, because you may need some professional support with this. If you were like me and I was in chronic pain for 20 years, it's going to take some time. This is not an overnight thing. For some people, it is. They read the book and boom, they got it. For other people, this is going to take time. I share this as a resource. This is Kirsten. This is my personal trainer. She works virtually with people because movement is the answer, not the problem, because it's going to help to rewire that fear loop. If we avoid movement, the brain goes, oh, see, that wasn't safe. That's the problem. We're in pain. And this is going to help to build confidence, to start trusting your body, to help regulating your mood and your nervous system. Lifting weights was one of the most transformational things that I've done in my life. And I really want to encourage women. I would say how I transformed my life: doTERRA, weight training, brain retraining, completely transformed everything, like adding in these products, adding in these tools, all of these things. So I'm going to really encourage you women, pick up some weights, start to weight train. I can go on and on and on about the benefits, but it will help with your pain. And it will start to retrain and go, oh my gosh, it is safe to move. Kirsten, her birthday was yesterday, and she has a lot of different programs and options, but she's running, she just turned 41. She's running 41% off of her weight training program. You can do it from anywhere. It is amazing. Start to move your body, whether that's walking or weight training, move your body. This is a really interesting program. If you're somebody who is like, okay, Laura, I want to dive deeper into this. I want to learn more about this. This is a online program that goes through education about pain retraining and pain reprocessing therapy. There's meditations for pain. It has some physiotherapy exercises, some master classes. It's kind of a cool thing too, especially for people who are like, okay, I like need a program for this or want to know what this looks like in depth. Somia also has an online program. I've done all of these and I found them to be helpful. It's just different ways of learning about the body. Somia has a lot of somatic exercises and some tools that you can kind of learn. We're basically figuring out the language of the body and how to start tuning into that and what that looks like. You could find a therapist or a coach. I work with a somatic experience therapist. She is freaking amazing. It has been huge. The Pain Psychology Center has coaches to kind of help people with chronic pain. And I know you may be thinking, Laura, you're telling me that I need to go to therapy to help with my chronic back pain or whatever. Yes. Yes, I am. It's going to help with a lot of things. And the research shows that people going to consistent therapy are noticing improvements in their immune system, in their inflammatory state. They're less reactive, they're less inflamed. And we see that on the labs, like people that just start to go to therapy to work on these things. If you've had trauma in your childhood or growing up, or, and it doesn't have to be like big T traumas that we think of. It could be other things coming up that we have no idea. The body's talking to you for a reason. It's trying to get your attention in the best way it can. This would be a really good place to start, and another tool and something I found helpful. It changed the way that I look at my oils and how I use my oils. So I challenge you, if you have an oil near you, go grab one. One of my favorites, I love Shinrin-yoku or Adaptive for this because both of these oils help with stress, with overwhelm, with lowering cortisol levels, with tons of things. Grab your oil. But you can use the scent to anchor your body. Because one of the cool things is when we're freaking out, the frontal cortex, the processing center of the brain, kind of shuts down, but we can get into the central nervous system through smell. So it's a way to kind of bypass words. And it's kind of where, like, if you're freaking out, it doesn't help sometimes for people to just be like, calm down or relax, or like that's the last thing we want to hear when we're freaking out. But if we can inhale an oil, it can help. going into through the olfactory nerve into the limbic system. It houses our memories, moods, and emotions. It's that direct link into the central nervous system. So that can be a powerful tool. What I want you to do is take it a step further and do a little ear massage. So if you're familiar with our aroma touch technique, when we put lavender oil on, we do a little ear massage. Oh my gosh, it's the best. Like, just do this throughout the day. Just do a really gentle, put your favorite oil on, and then just give your earlobes a little massage. If it's feeling good, do a little massage down your neck. You can apply it around the vagus nerve. So going right behind the ear, down the side of your neck. You can even kind of do a little massage there. It is lovely. Diffuse your oils throughout the day. What I want you to start thinking about with your oils is this is comfort, not correction. This is taking the edge off of my nervous system because that's a very different energy than, I'm hurting. I need to grab this oil to fix it or run away from the pain or get rid of it. We're bringing it in as like, we're bringing in more comfort. We're supporting our nervous system, different energy. Because if we're telling the brain that we're trying to get rid of something or run or put a Band-Aid on something, that creates more of that kind of feeling versus, oh, let's just use our tools to support us. So I use my oils in a different way now. And I use them in a routine where like we can put our frankincense and our copaiba under the tongue morning and night. We take our foundational wellness supplements and we diffuse our favorite oil. I think about foundational wellness supplements are nourishing our body and diffusing supportive oils for our nervous system are like vitamins for our soul. Like it's an experience for our nervous system. I think it is just as important to fire up your diffuser every morning as it is to take your supplements. Really, really important. You can put some adaptive touch over your vagus nerve, do some deep breathing, just slow down. And I want you to notice how often you may just, without even noticing it, be breathing really shallow, be rushing around, your shoulders are up here, and just take a moment to pause. Use your oils as a reset to come back to your body and start to slow down for a little bit. Take a beat. With your movement, because I want you picking up weights and weight training, you're going to use your deep blue and put it on before and after exercise, whether that's the stick, the rub, the oil, choose your own adventure with that. In the evening, especially for somebody who really struggles with sleep, I love this idea of having a worry journal where you just get it out. What are all the things that keep you up at night? So this is a really interesting thing about insomnia is it's directly linked to your nervous system. If your body and your nervous system can't relax during the day, it's going to keep you up all night. So do a brain dump of everything that you're worried about, freaked out about, like write it all down, get it out of your body, and do that with a relaxing oil like Console or Peace. And then my favorite bedtime diffuser is Serenity and Shinrin Yoku. Oh my gosh, if you haven't tried that, it's amazing. Put some Serenity stick on the bottoms of your feet, take 2 Serenity soft gels, or you can do the Emily Wright, 1 Serenity soft gel, 1 Copaiba soft gel, 1 adaptive capsule. It's a good combo for sleep and for supporting your nervous system. Helps with your sleep. So this I think is really important too. If the pain could talk, what would it say? What was going on in your life in terms of emotions and stress when these symptoms started? Can you go back? Can you remember who that person was? Can you show that person compassion and grace? Why are these sensations showing up where they are in the body? Like if you're having back pain, why your back? Start to ask these questions, start to pause. Why are they showing up now? See what comes up. It's real interesting to kind of get quiet and ask some of these questions. And I think it's important to remember that healing is not flipping a switch. And we want it to be. We want it to be fast and just be better and feeling great. But instead, healing is like learning how to play a new instrument, learning a new language, learning how to play a new sport. It's going to take time. It takes practice to master this. So with these tools, I'm just giving you a few things to kind of dive into, but go easy on yourself. Show yourself a lot of compassion with this. There's a bunch of great books on this. Like you can dive deeper into all these things. And if you're somebody who has chronic pain, you're probably a little bit more hypervigilant. So you're like, give me all the books and I want to learn more. Like we tend to like want to go down our little checklist of all the things. Here's some good books that you can check out, that you can kind of see. And I would also recommend do enough to kind of learn the brain science, the neuroscience behind this, and also give yourself space too, because I think we can overdo it really easily with trying to learn all the things and do all the things. And this is a really interesting handout. So, Dr. John Strax is another really amazing physician who specializes in mind body healing, neuroplastic pain. And he has this handout from his clinic. He has a clinic in Chicago, I believe, where if you feel like you're struggling from an illness or trauma or something, these are some really great tips and some strategies on like where to go from here and things to kind of ask yourself and work with. So this is a great resource and tool from him. He has another one as well. This is 10 reasons for pain and other chronic symptoms. Check them out. Go download them, diffuse a great oil, sit down, see what comes up as you're reading these. See if anything resonates. Again, take what resonates, disregard the rest. But these are two really powerful tools from two amazing mind body physicians that I really love and respect. And just, again, healing is not linear. This is going to happen in small increments, gradually over time. And the more that we can approach this with compassion and patience and love and start to celebrate the small wins, your brain will start to seek them out. Praise the effort, not the outcome. Do that in life. Do that with our doTERRA business. Do that with all the things. I think that's really, really important to remember here. And then just some general tips, like we want to nourish ourselves with good food, eat your protein. A lot of people are not eating enough protein, lift your weights, go for a walk in nature, and don't listen to anything without your phone, without the podcast, without the audiobook, without all of that stuff. Take time for rest and pleasure. Make sure you're getting enough sleep. I want you belly laughing. Laughter is good for the soul. Use your oils, take some deep breaths, love on your nervous system. And people in chronic pain or with anxiety or depression, it is recommended that we play 4 to 5 hours a week. Non-productive, just for fun. If you don't know how to do this, watch a little kid. What can you play? What did 8-year-old you love to do? Go and do that. We need more play. We need more rest. We need more fun in our life. It's good for you. It will help with the healing. I'm in all the places. If you want to come and find me on Facebook and Instagram and YouTube and all of the things. And I know that this may sound kind of hippy dippy to some people. It definitely took everything that I learned about chronic pain in PT school and kind of spun it on its head. But it has also been one of the most transformative things for me. And since adding in this work, I found that my anxiety improved. As my husband, Mark, called it, he said, it seems like your spirit is coming back. Because when you are in chronic pain, you're just enduring. It takes a lot out of you in a lot of ways. And so I also want to say, I see you, and I just want to remind you that you survived. You're still here. Whatever those challenges or traumas or things, you survived. And when we have that really powerful belief that healing is possible, that our body is designed to heal, that our body is designed to thrive, that is the normal, and that pain is a messenger. It's the check engine light. It's letting us know. And when we can approach it with a lot more compassion versus fear and retrain, they always say those neural circuits, neurons that fire together, wire together. When we start creating, the amazing thing about the brain is it is very neuroplastic. Healing is possible. And we have these beautiful gifts of the earth and the tools from doTERRA. We can do both and combine them in to help with our healing.
Thank you, Dr. Laura, so much. I'm going to wrap up, and then if you want to look at the Q&A, that would be great. We do not record it, so when I'm done giving my piece, we'll do the drawing, and then stay tuned so you can get your questions answered. Go ahead and submit them now, and the giveaway tonight is the deep blue little travel that we will have filled and sent to you. Okay, so if you haven't done so already, many of you are on the call each week and you're just so tired of hearing it. For those of you that are new, please join the Discover Essentials Facebook group. It's bit.ly/Discover Essentials. That is case sensitive, or click on the QR code. And folks wonder often, when is this going to be recorded? I don't ever worry. I don't have to dig for it. It's sent in my email. So please join that. And they send 1 or 2 reminders a week for the event coming up so we can mark our calendars, but very educational. And then tonight, no one needs to check the grad progress because anything prior to last week is gone off the counter. So we're going to all start tonight. So take a picture of this or click the QR code bit.ly/continuing ed 2026. The permanent library has got an abundance of information in it. And just a reminder, the 3 classes that we had in December, including Dr. Nicole Stevens, Alicia Hogstead, and I'm not sure what the last one was, those are going to be done today at midnight. So go out there. They're on my Facebook group. They're also under Discovery Essentials, and those will be going away tonight. And I did all that I can. We could not get Dr. Nicole because of many reasons, but we could not get her to be put in this library, and that's what kind of triggered me. So bit.ly/permanent library DE stands for Discovery Essentials. Some great information is in there. So when you're done in 10 weeks, so many of you were on last week, despite the fast start or the jump start, you were still on. You are eligible now in week 2, so after 10. So please go out there and register because we're all adults and this is our responsibility to fill this out. And tomorrow, it's gone. So we always say 1 hour after. Make sure that you do it as soon as you get done. And then you can either select at the 10-week mark, either 2 of these. Just think in a year, you'll have all these done. You'll get the whole kit, which is like $100 and almost $50. Or this 97 teachable course. And if you've already done it, gift it to someone on your team. These aren't that expensive, but gosh, this is absolutely an amazing course. So keep that in mind. 3 types of people that joined doTERRA: live, share, and build. That was definitely me. And for those of you are doing it tonight for the very first time and listening to this, I know I've been looking at the people that are on. There's a number of you that are brand new that just joined doTERRA and looking to change a lifestyle. Every Wednesday, please join us. 3 ways to purchase, retail, wholesale, and below. Sandy wants everybody to get the below. And how do I do that? There's bit.ly/enrollment kits. All the kits are there. And so we just did this in December. And I'm going to maybe even do it by tomorrow night so that I can maybe get another frankincense. I go out there and do all my inventory and find out what kit best suits all the oils that I'm missing, and then turn around and purchase a kit. That's where all the savings is versus buying 10 individual oils. So bit.ly/enrollment kits US. And then that will guide you to get less than the 25% off. And then those of you that are brand new, if you have over 150 PV, you can select one of those. These kits are coming here soon, so watch for these as well. And please reach out to me if you want, text me. If you're looking for the discount code, it's huge, it's 50%. So guys, that's a big, big code. So it's worth getting to do the reset with PJ. Many of you on the call know her. If not, reach out to me. I'll tell you, she is one of a kind, outstanding, extremely knowledgeable. And the gifts that we're going to be getting via email and text are going to be incredible because I'm already in the program. I signed up right away. So there's my email address, phone number, text me, whatever it is. Changing the world, one drop, one person, one community at a time. So I'm going to stop sharing. And